I'm delighted to introduce Paul Bradshaw, who is the director of ScotCen Social Research, which is an independent not-for-profit research institute, and the Scottish arm of NatCen Social Research. In a career spanning 20 years, Paul's worked on a wide range of studies across many policy areas, but his primary focus has been on research on children and families, and most notably, his role in Growing Up in Scotland, which is a multi-scale, multi-cohort, multidisciplinary, longitudinal study commissioned by the Scottish Government. And it's a fantastic piece of work. And Paul's been leading that since its launch in 2005. So it's my great pleasure to introduce you to our first speaker, Paul.
Okay, thanks, Bruce, and good morning, everyone. Really delighted to be invited to kick things off this morning. And it's really my job to try and bring some oversight and an overview to some of the issues that are going to be coming up over the course of today by drawing on evidence and findings that we've gathered through the Growing Up in Scotland study. So let me start just by telling you a little bit about Growing Up in Scotland, because there might be some of you out there who have not come across the study before. So Growing Up in Scotland, or GUS as we affectionately call it, is a large-scale longitudinal birth and child cohort study. We launched the study in 2005, and since that time it has involved 3 cohorts of children, 2 that we launched in 2005 that we call Birth Cohort 1 and the Child Cohort, and then a second birth cohort that we launched in 2000. And each of the birth cohorts have around 6,000, but between 5,000 and 6,000 children in them. And those are children that are nationally representative of all children in Scotland, and they represent about 1 in 10 children born over the 12-month period that we sampled. So quite a significant representation of all children from all areas and backgrounds in Scotland. It's commissioned by the Scottish Government, as Bruce has said, and we've been running since 2005, and we've collected rather a lot of data since then, as you can see from this screen, which outlines the age points at which we've gathered data from each of the cohorts. And the main thing to note really from this slide is that the cohort in which we have the most detailed set of data is Birth Cohort 1, and those children are currently age 17, and we're in our 11th sweep of data collection with them. We're actually in field at the moment collecting data from these 17-year-olds, but we've got a really detailed picture of those children's lives, including annual data collection from the first 6 years. And so it's data from that cohort that I'm going to be mostly referencing today, but I'll also be bringing in some data from Birth Cohort 2, who are a more recent cohort, those children born in 2010 and 2011. So they turned 5 in 2015. But we are only following Birth Cohort 1 now. The study gathers data from a wide range of sources. Our principal source of data is a face-to-face interview with the child's main carer, very often the child's biological mother, but not always. We have grandparents, foster parents, adoptive parents, fathers and so on involved as main carers too. We gather data from partners, of course from the children themselves who have been completing questionnaires from us since age 8. We measure their height and weight, we ask them to do cognitive assessments, and of course we're linking to the really rich administrative data that is gathered in Scotland on children's health, on their education, and more recently we're hoping to link to data on attainment from SQA and post-school destinations from Skills Development Scotland. So a really rich data set, and the data that we gather is really wide-ranging in the topic that it covers. You know, GUS isn't unlike many other multidisciplinary cohorts that you may be aware of, Millennium Cohort, for example, these cohorts which are informed by a social science approach, which means that GUS has the potential to inform evidence-based policy in a wide range of domains, which makes it incredibly useful to a really wide set of people. And all of these data are available for external researchers to access, as well as for use within Scottish Government for analysis. So, but what can all these data tell us about the early years experiences of children in Scotland? Well, quite a lot, actually. And so what I've started with is I've narrowed it down to age 5. So I'm going to draw on some data covering the birth to age 5 period, as this sort of falls in the middle of the age range that we're looking today, and it coincides with primary school entry for most children in Scotland. So when we look at children's lives up to the age of 5, the data tells us that most children have what we might call typical experiences. They mostly live with 2 parents. Their parents mostly work. The children are mostly healthy. They develop normally. They don't experience any notable issues or problems. But some children, of course, do experience some potentially adverse issues over the early years of their lives, certainly by the time they're aged 5. And I've put some of those experiences up on the graph here. Now, these are in ACEs, adverse childhood experiences, as they're defined in that literature, but they are certainly issues or experience that we know from analysis of GUS data impact on children's outcomes. So what you can see is that between birth and age 5, 10% of children whose parents were together when they were 10 months old had separated by the time they were 5. Over the course of those 5 years, a quarter of children had had no parent in their household employed at some point. 8% had been persistently in a low income group over that period. Now, that's not poverty, child poverty as defined in the statistics. It's actually they've been in the lowest 20% of household incomes over that 5-year period, which is actually a harsher measure than the child poverty measure, but simpler one for me to run off. Around a fifth have had a long-standing illness or disability. Very small number have experienced the death of a parent or parent figure, but much more significant numbers, 2/5 of children have moved home over that period. Now, it's pretty unusual for children to experience 2 or more of these events, but we do know that many of these events and issues are more common for children in lower income households or disadvantaged households. So by age 5, compared with all children in the lowest income households, 3 more likely to have seen their parents separated, almost a little more than twice as likely to have had no parent employed, and of course that's linked to being in a low income household, and slightly more likely to have moved home. No difference there in the extent to which they've experienced long-standing illness, which I think is probably related to the measure that we've used. And if we used a limiting long-standing illness, we might have seen some differences there. Now, this trend, I've shown it by income, household income, but actually it's evident across a range of measures of disadvantage. So if we looked at it by area deprivation, if we looked at it by parental level of highest level of qualification, we would see a similar pattern. Now, these data have given us some insight into children's circumstances and experiences, but what about their outcomes? So I'm going to share some findings on 2 outcomes that we've routinely measured in GUS. The first will be social, emotional and behavioural development, and we measured that using the Strengths and Difficulties questionnaire, and that is usually completed by a parent. We've got later measures where the young person and a teacher has measured it, but I'm not be referencing those data this morning. I'm also going to be talking about data on cognitive ability. Now, we use the data I'm referencing this morning is from the British Ability Scales, expressive vocabulary or problem-solving assessments. That's what we've used over this age point. It's only the vocabulary ability data I'm going to be talking about. So let's start with social development using strengths and difficulties data. And again, I'm taking age 5 as an example here. Now, SDQ scores can be categorized into 4 groups. Close to average, slightly raised, high or very high, and I've collapsed the 2 highest groups into one here. What you can see from the graph is that problematic social, emotional or behavioural difficulties at age 5 are not very common, but they do affect a significant minority of children. So if we look at the total difficulty scale, which is an amalgamation of all the 4 subscales, the bottom bar there, around 10% of children have a high or very high score there. But what you can also see is that the proportion varies depending on what subdomain of social development we're looking at. So almost 1 in 5 children have reported difficulties in the hyperactivity domain. Around 1 in 6 have difficulties in the peer problems domain, but it's much lower when we look at emotional symptoms at age 5, just 1 in 20 children. These proportions, of course, change over time, and in particular, what we've got here is between age 5 and age 8, the proportion of children with high or very high difficulties tends to increase. So you'll note that proportion in the dark groups, the darker coloured bars here, the close to average group with no difficulties, that proportion has decreased, whereas the proportion in the lighter shaded groups, those children with difficulties, has increased. And this is particularly notable for emotional symptoms and conduct problems. So if we look at emotional symptoms, the proportion of children with any difficulties increasing from 5% to 15%, and the proportion of children with difficulties in the conduct problems domain doubling from 12% to 23%. Now, these data are cross-sectional. They're national averages, they're representative for all children in Scotland. But we know from longitudinal analysis of GUS data, which is one of the unique and very powerful things about the study, that many children with difficulties at age 8 and indeed with difficulties at age 5 have presented these earlier in life. So this table here looks at the relationship between SDQ scores at around age 4, when children would be in early learning and childcare, and then their scores at around age 5 to 6, coinciding with their first year at primary school. And what we see here is that the vast majority of children whose scores were in the close to average range at age 4 also scored in that age range at primary school. So 85% for conduct problems, 91% for emotional symptoms. What this means is that if children have had positive social development to that point, this is likely to continue, at least in the short term. And it's also notable in the green there that most children in the slightly raised group at age 4 had moved into the close to average range when they were in their first year at primary school. So many children with difficulties when they are younger show improvement in their social development over time, and those with positive development at age 4 maintain that for the most part as they move into primary school. But what's also clear is that for some children there's no improvement in behaviour, and difficulties which are present at a younger age persist for a minority of children. So here, for example, we see that 42% of children whose conduct problem score was in the high or very high range at age 4 had a score in the same range in their first year at primary school, and a similar proportion for emotional symptoms. So we don't see any improvement in these children's social development over this period. What we also know is that children in lower income households are much more likely than those in higher income households to have reported difficulties. This relationship is evident and consistent at multiple age points, as you can see from the graph, which shows differences in the proportion of children with scores in the high or very high range of the total difficulty scale by income group at ages 4, 5 and 7. Children in the lowest income group are at least 4 times more likely to have difficulties in the high or very high range than those in the highest income group. And this trend, again, evident across a range of measures of disadvantage. So if we look at it by area deprivation, very common measure used in lots of statistics, we see a similar trend. The difference is perhaps not quite as harsh as we see it by household income, but nevertheless the trend is still there. Let's turn now to our other outcome measure, cognitive ability. So this graph displays the mean standardised vocabulary ability scores at ages 3 and 5 by household income, socioeconomic classification, and parents' highest level of educational qualification. So by standardising the score, we can compare the position of groups of children at both age points. When we do this standardisation, it sets the average score to 0 and measures higher or lower ability in terms of standard deviation. So looking at the graph, the main thing you need to know is that the black horizontal line, the x-axis, running through the middle represents the average score for all children in Scotland at age 3 or age 5 and age 5. Anything above that is a higher than average score, anything below it is a lower than average score. So looking at the purple bars on the left-hand side, for example, we can see that at age 3, children in the highest income group scored 0.27 standard deviations above average, whereas children in the lowest income group scored 0.5 standard deviations below average. This is an illustration of what we've commonly come to refer to as the attainment gap. And what you can see is that irrespective of the measure, children from more disadvantaged circumstances show significantly poorer than average ability, and they are considerably poorer in comparison than their most advantaged peers. These numbers don't look very large, but these differences between the most disadvantaged and the most advantaged groups equate to between 12 and 18 months of cognitive development delay at this age, at age 5. And in fact, this difference persists through the primary school period. So here we have similar data presenting average scores and the range of scores and vocabulary ability, but this time at age 10 when children were in primary 6. And scores this time are grouped by parents' highest qualification. So what we can see, looking at the average scores, it's the line in the middle of the box. By the time they were in primary 6, children whose parents had lower standard grade qualifications or no qualifications scored 0.49 standard deviations below average, and those whose parents had a degree scored 0.25 above average. The gap between children in these groups shows no notable change at primary 6 from the position they were in at primary school entry. And that gap and these differences by social background also have persisted between our cohorts at a similar level. So here I'm comparing average ability scores by income group across our two birth cohorts. These are birth cohorts born 6 years apart. And you'll see there are small differences on the whole in the scores for each of the income groups, but on the whole the trend is the same. Children in higher income groups have higher average scores than children in lower income groups. And the size of the gap between those in the lowest and highest income groups has not particularly changed either. So what does GUS evidence suggest might be done to address these inequalities in experiences and outcomes? Well, we know it's really difficult to counter the powerful socioeconomic influences on children's lives, but in exposing and attempting to understand more about the inequalities that children face, analysis of GUS data gives some pointers to how policy and practice might better assure positive outcomes or build resilience in the face of socioeconomic disadvantage. First, we know it's really important to support positive development from the very earliest stages of a child's life. Positive early development is highly predictive of positive later development. And this actually starts before the period we're mostly focusing on today. And I think Alan Sinclair is going to be talking a little bit about that earlier period later today. But from the point our children start accessing early learning and childcare, for example, there's a significant opportunity to start making a difference, and we should be making the most of that. Now, universal policies which seek to improve children's outcomes will not benefit all children equally. Our evidence shows that children from disadvantaged backgrounds have different experiences over early life and are significantly more likely to have poorer outcomes. So we need to understand and share how these children can most effectively be identified and supported. Pupil equity funding is a step in the right direction in this respect. GUS evidence shows positive associations between attending high quality early learning and childcare and positive child outcomes. And this is a finding that's echoed in other UK and international research, which you may hear about over the course of today. We've great opportunity here, as analysis from GUS also shows that in Scotland, high quality early learning and childcare is equally available to all children. So this graph shows the proportion of children attending a high quality early learning and childcare centre by area deprivation. And apologies, it's not clear from the graph that it's area deprivation and not income, but that's what we're talking about here. So you'll see whether you're in the most deprived 20% of areas or the least deprived 20% of areas, you've got about equal chance to be attending high quality early learning and childcare. Now, whether 30% of children is enough to be routinely accessing it is another question, and I'm sure that's something that John McKendrick might be coming on to shortly. What else? Well, we know that children with poorer transitions who have difficulty adjusting to the learning and social environment at primary school and poorer ongoing engagement with school are likely to have higher levels of behavioural and emotional problems. What we don't know and what we haven't looked at in GUS is whether low school engagement occurs because these children already have behavioural difficulties, whether behavioural difficulties increase because school is not engaging for them, or whether there's interplay between both of these issues. So understanding that better, why some children are less engaged with school, and changing practice to increase their engagement, as well as doing more to ensure positive transitions, particularly with children, for children with social and emotional difficulties, is likely to benefit their social, emotional and behavioural outcomes. And transitions, of course, is something you can hear more about later today from Ali and Wendy Dunlop. And of course, better social and emotional well-being is also beneficial for children's learning. As such, wider steps to tackle this in school and early learning and childcare centres, and there's work already ongoing in this area, but that may lead to increased attainment and a reduction in the attainment gap. This means creating conditions for positive learning, successful relationships and the prevention of bullying and violence. Finally, what GUS evidence tells us is that whilst early learning and childcare and early primary school experiences are clearly associated with development, parenting and the home environment also play an important role and can help overcome some of the disadvantage that children face, particularly those children in lower income households. So strategies to improve outcomes amongst disadvantaged children must take a holistic approach, with parallel strands operating in early learning and childcare centres and schools and in the home environment, and should seek to impact both the child and the parents and their carers. I'd like to thank you all for your attention today. I want to just give some acknowledgements to colleagues on the GUS research team, particularly Lena Knudsen, some of whose research I've been referencing today. I hope you enjoy the rest of the conference. I'm not taking questions, but very happy if you want to put some in the chat or email me, contact me afterwards. I'd be happy to get back to you. Thank you very much, and I'm going to hand back to Bruce.
Thank you so much, Paul, for such an incredible presentation of the immense work that you and the whole team at the Growing Up in Scotland study have been doing. If we were all in person, everyone would be clapping. We'd probably be on our feet at the moment. But I would ask delegates sitting in your own homes to show your appreciation to Paul by clapping, waving, yelling. You can use British Sign Language if you'd like. Paul won't be able to see it, but I'm sure that he will feel the appreciation from all of you for that fantastic presentation. The strong links that you made, Paul, around the importance of the evidence framework that you've developed, which really tells us about the importance of investing in families, of early and effective targeted interventions, that high quality learning and childcare that you evidenced as showing having impact throughout childhood. And I think that really speaks to some of the great optimism that we can have maybe around some really good innovative practice that's available throughout Scotland, but the need to make sure that that's working. Again, as will come up later, that focus on transitions and how much more difficult have those transition years been over the last couple of years with pandemic. And so the fact that transitions were already something that we were concerned about, and now with the pandemic so much more, that focus on social and emotional well-being, and remembering that the Convention on the Rights of the Child focuses on creating a family environment of happiness, love and understanding. And so the research showing how important that support for the family environment is really links with our obligations to human rights. So what a fantastic presentation that was, Paul, and what a great way to start the day.